Hi, I'm Matt Ward, a consultant paramedic and the head of clinical care. This presentation is to introduce the Meditech MicroVent. Following a review of the mechanical ventilator used within the trust, a decision has been reached that the Parapack Plus ventilator, currently in use within the trust, will be replaced with a new mechanical ventilator. The trust has chosen the Meditech MicroVent to replace the Parapack Plus. The Meditech MicroVent is lighter and easier to use than the current ventilator. The indications for use of this ventilator are adults and children greater than 10 kilos with spontaneous circulation requiring mechanical ventilation due to apnea. Contraindications include children less than 10 kilograms in weight, any patient in cardiac arrest, and patients with respiratory effort. In these cases, the patient should be managed with the appropriate airway, bag valve mask, and high flow oxygen with end-tidal CO2 monitoring included. The technical information regarding the MicroVent includes a tidal volume selection of between 0.15 to 1 litre and an automatic frequency of between 10 to 25 breaths per minute. This is selected by the operator using a single slide switch to alter both ventilation, frequency, and tidal volume. It has a continuous oxygen concentration of 100% with an inspiratory-expiratory ratio of 1 to 2. It must be remembered that at all times during ventilation, the rise and fall of the patient's chest, oxygen saturations, and end-tidal monitoring should be evaluated to ensure adequate ventilation. So let's look at the anatomy of the MicroVent. You'll see at the rear of this picture that there is a switch that allows you to switch between manual ventilation and automatic ventilation. To the top of the device is a pressure limiting valve which emits an audible warning if the pressure is exceeded. There's a trigger valve which allows you to manually ventilate the patient. The trust is recommending that a bag valve mask should be utilised when considering manually ventilating a patient, and to only use the ventilator for patients requiring intermittent positive pressure ventilation by the cycle system within this ventilator. You'll see at the front of the device there's a selector switch, which is a slide switch moving between an adult and a child image. Moving this switch changes both tidal volume and rate of ventilation. It's important when setting up the ventilator and connecting the patient to immediately look for rise and fall of the chest. If you've selected a lower setting for the ventilator, then you should move the selector switch to the right in order to increase both tidal volume and decrease rate of ventilation, more akin to an adult. Remember, at all times you must ensure that there is adequate ventilation for the patient, assessing rise and fall of the chest, oxygen saturations, and end-tidal CO2. The ventilator can be found within the ALS bag. Bags carrying the ventilator will have one of these tags attached to it to indicate a ventilator is within the bag. So let's look at setting up the ventilator. The ventilator can be found within the yellow bag in the depicted ALS bag. Take the ventilator from the bag and the ventilator hosing. Remove the ventilator hose from the packaging, ensuring that any articles that have been displaced during transit are also collected. Check that both ends of the ventilator hose are clear of obstruction and connect any of the articles that have come off the hose during transit back to the ventilator. Then identify the Schrader valve Check that there's enough oxygen within the cylinder and connect the ventilator to the cylinder. Moving the selector switch from manual to automatic starts the ventilator. Moving it back to manual turns the ventilator off and preserves oxygen whilst not in use but connected to the cylinder. The slide switch on the front of the ventilator has a sticker beneath it depicting an adult and a child. Moving the slide selector to the left increases respiratory rate and reduces tidal volume. And there are indications for the rate and approximate tidal volume on that sticker. Moving it all the way to the left is for a small child, and all the way to the right is for an adult at 10 breaths per minute. Leaving the device on manual allows the trigger to be squeezed, which allows for manual ventilation. Turning the device back onto auto starts the ventilator functioning, as you can hear. Before connecting the ventilator to the patient, ensure the ventilator is switched on to auto. Connect the ventilator to the patient and ensure there is adequate rise and fall of the patient's chest. Monitor oxygen saturations and end tidal CO2, capnometry and capnography to ensure adequate ventilation. Ensure there is always a bag valve mask available with the patient in case of ventilator failure, so that ventilation can be taken over using the bag valve mask until the problem is resolved. So let's just go over the ventilator preparation again. Firstly, ensure the oxygen is on. Ensure the ventilator is connected via the Schrader valve to the oxygen. Test the ventilator function by turning the switch from manual to automatic and checking that the ventilator cycles. Set the slide switch to the approximate age and size of the patient and select automatic again and recheck the ventilator is working at the rate selected before connecting it to the patient. Following use of the ventilator hose and airway circuit should either be handed over with the patient or disposed of via the clinical waste. The device and the oxygen supply hose should be wiped thoroughly with a trust-approved surface wipe. If there is risk of internal contamination, it should be withdrawn from use and returned to the VPO for formal decontamination. When the ventilator's been cleaned, return the ventilator to the yellow pouch along with a single-use ventilator hose. This should be then returned to the ALS pouch. Where the ventilator is taken out of use, the whole ALS bag, including the ventilator, should be returned to the VPO and exchanged to prevent responding without a ventilator. Thank you for listening to this video. In summary, the microventilator is a light, portable and easy to use ventilator in the pre-hospital phase of care. Our enhanced care teams will continue to carry more complex ventilators. Their indications and uses are different to those of the MicroVent, and the information contained in this presentation and the manufacturer's information must be followed when using the MicroVent. At all times during ventilation, the rise and fall of the patient's chest, oxygen saturations and end tidal CO2 should be monitored to ensure adequate ventilation. Thanks again for listening. If you are confident with the function of the ventilator after you've watched this presentation and read the clinical guidelines and manufacturer's instructions, you can commence using it immediately. If you need further advice or support in using the MicroVent, then please contact your CTM in the first instance. If, following support from the CTM, you require further support, please speak to the Duty Operations Manager on duty.